all of the physicians were always asking, are you planning on commercializing this? Canadians currently wait at least 3 months for a medically necessary MRI, and that's really the pain point that we're trying to solve, is provide physicians with an accessible three-dimensional imaging tool.
Today, I'm joined by Randa Mudathir, the CEO and co-founder of Novasonics Healthcare. Randa's background is in ultrasound research and 3D imaging, and she originally thought she'd follow the classic academia route all the way to a faculty position. Instead, her master's work on 3D ultrasound for thumb osteoarthritis led her to team up with her lab mates and mentors at Western University, forming a founding team and building Novasonics around that technology. Now she's spent the last couple of years leading the company full-time, navigating everything from hardware iterations, clinical pilots, share splits, and regulatory strategy. In this episode, we'll talk about how that transition from researcher to CEO actually felt day to day, what she learned about product market fit, and why keeping usability front and center has been so important for Novasonics. Yeah, so let's just start off with a quick introduction of who you are and brief summary.
Yeah, absolutely. So I'm Randa, CEO and co-founder of Novasonics Healthcare. We are an early-stage medtech company that spun out of Western University, and we've developed an attachment that you can attach to any commercially available ultrasound probe, and it will convert it into a real-time three-dimensional ultrasound scanner. And we're particularly focused on musculoskeletal imaging, because currently, when a patient presents with a musculoskeletal disease or injury that requires some form of 3D imaging, the default is MRI because there are no accessible forms of 3D imaging available. And of course, if you're Canadian, you know how staggering the MRI wait times are. So Canadians currently wait at least 3 months for a medically necessary MRI, and we've spoken to some patients who've waited up to 2 years. So that's really the pain point that we're trying to solve, is provide physicians with an accessible three-dimensional imaging tool that they can use so that patients no longer have to wait so long for an MRI unless they really actually need it.
Mhm. That is such a great mission statement, and I appreciate how you concise that all down. You're the second person I've met from Western University, actually. That's so
Oh, really?
sidetrack. Yeah, do you know Sydney Robinson?
Yes, yeah. She was one of the founders we really relied on when we first started up our company, and we had no idea what we were doing. So we would always be asking her for advice. And I still ask her for advice. She's great.
She's wonderful. So I had her on a couple of weeks ago. That's so crazy. So let's dive into kind of what you guys are doing at Novasonics. So you talk about these MRI wait times and how ultrasound can be modulated to create this 3D image. What additional information is the 3D providing that's really critical to solving the challenge?
Yeah, absolutely. So I'll talk about current ultrasound techniques that are available to physicians for musculoskeletal diagnosis. And currently, the accessible forms of imaging are just 2D ultrasound. So the limitations with 2D ultrasound is you're getting a 2D image. So you're not seeing the entire structure or volume that you're trying to assess. Now, aside from that, conventional ultrasound is incredibly operator dependent. So you need a very well-trained operator to be able to capture a good quality 2D image that gives you the information that they need. Where our device fits in is it clips on to existing ultrasound probes that clinics already have, but we automate the scan so we reduce a little bit of that operator dependency, and we also allow physicians to capture a 3D image. So we're filling in the gap with both 3D imaging, but also reducing a little bit of that operator dependency.
Okay. Going back to a lot of your master's work, which is pretty much fundamental to the formation of the company, what clinical problem were you guys seeing specifically in this area that made you think like, hey, this needs to be improved?
Yeah, so there was a couple clinical problems that I was working on during my master's thesis, and this was kind of in combination with the master's theses of two of my other co-founders. So the three of us actually met in graduate school and we were working on this project together. But we were particularly looking at patients with thumb osteoarthritis. So thumb osteoarthritis is one of, the more common forms of osteoarthritis, and it currently has no cure. And so oftentimes patients are diagnosed once osteoarthritis has progressed into causing bony damage. And so the research question that we were exploring is, can 3D ultrasound help physicians detect early symptoms of the disease so that it gives patients the chance to get more conservative forms of intervention, such as, steroids or anti-inflammatory medications to help manage early symptoms of the disease, which are primarily joint inflammation. Because currently, the main way of figuring out the amount or the volume of inflammation in the joint has been MRI. That's the gold standard. And so what we did is we had patients come in, we imaged them using our 3D ultrasound technology, and we also imaged them using MRI. That was actually a large portion of Carla's work. So Carla's one of our co-founders, and she essentially compared with the measurements that she could gather from 3D ultrasound in terms of joint inflammation and in MRI, and she compared the two. And we found that the difference was actually less than 2%. And 3D ultrasound was better than MRI at detecting longitudinal changes in inflammation. So when we were tracking patients' progression as they were getting their medications, 3D ultrasound did a better job at showing us how much that inflammation changed over time than MRI. So that was the specific indication we were working on through our master's theses. But other clinical applications that we've looked at include, changes in knee cartilage thickness, changes in knee inflammation. We've looked at tendon tears. So we work with an orthopedic surgeon who primarily treats injuries and diseases in the hand and wrist. So a main clinical pain point that he experiences is he has a lot of patients come in that get tears in their flexor tendons, which are the tendons that allow us to flex our fingers. And he says that oftentimes he has to make an on-the-spot decision whether the tear is severe enough for him to take the patient to the OR and surgically repair it, or the tear isn't that extensive and the patient will be just fine going through physiotherapy. And the reason why he has to make that on-the-spot judgment just based off of his best understanding of the patient's case is he doesn't want to refer them to an MRI and have them wait months with an injured finger. And so sometimes he takes his patients to the OR and he opens them up and he realizes, the damage wasn't as extensive as he thought. So they might have been just fine doing physiotherapy. And the opposite happens, where he sends some patients to physiotherapy and months later, they're not healing well enough because they actually needed to be surgically operated on. So that's another clinical pain point that we investigated, again, through our master's research project.
It sounds like there's a lot of different pressing needs. So then how did we get down to musculoskeletal specifically?
Yes. So when we were first investigating, or I guess I'll give you a little history about
Yeah.
why we first spun out Novasonics. When we first spun out Novasonics, we were pitching the company as a device that allows for early osteoarthritis detection because we got really fantastic results from the clinical trials that we were running with osteoarthritis patients. But the more and more we spoke to physicians, the more we realized that early osteoarthritis detection falls under a larger problem where physicians that treat musculoskeletal diseases and injuries just can't get their patients into an MRI in a timely manner. So we spoke to this hand and wrist surgeon, for example, and he was like, that's great, but I want to use it for tendon tears. I don't want to use the device for osteoarthritis detection. We've spoken to a shoulder surgeon, and he's like, osteoarthritis applications are great, but I don't want to use it for that. I want to know if after I do a shoulder reconstruction surgery on my patient, I can track their healing journey and how all of those tendons are settling in with the joint replacement. And so though there were all of these musculoskeletal clinical applications that our device could fit well into, and they fell beyond just osteoarthritis applications. So that's when we began shifting our messaging a little bit in that, our device can be used for various musculoskeletal applications and not just early osteoarthritis detection.
Let's go back to how you even got into the space in the first place. And then I also want to talk about your co-founders, but yeah, let's start with that.
Yeah. So for the longest time, I had a very clear path of what I wanted my career to be. I always I really enjoyed research. I enjoyed writing research papers even as a high school student. I loved anytime we had a research project in biology. So my career plan was to get a bachelor's degree, a master's, a PhD, find a postdoc position, and then get a faculty position as a professor. That was always going to be my career path ever since I was, a little girl, really. But a year into my master's, we were working on developing this technology and testing it and collaborating with different physicians and getting their feedback on it. And all of the physicians were always asking, are you planning on commercializing this? I would love to have this in my clinic. And up until that point, the device was being used purely as a research tool. Nobody had any plans to commercialize it. So I heard enough physicians say that they would love to have the device in their clinic that I was like, hold on a minute. Maybe, the value of our device is worth more than just being a research tool and being used in a lab. So I stumbled upon a local pitch competition that was looking for innovations in the musculoskeletal space. I pitched it to my supervisor at the time, who's also one of our co-founders. And I was like, Aaron, there's this pitch competition that's looking for musculoskeletal innovations. I think our device fits perfectly in there. Is this something that you would be open to? And he was immediately on board. So myself, our CTO Megan, our clinical strategy lead Carla, and then our two other co-founders and senior advisors, Emily Lalone and Aaron Fenster, we banded together. We formed our team, put together our pitch deck, and pitched it at the competition. And we ended up winning the competition. So that was kind of that's what set the ball rolling for Novasonics.
That's a very inspirational story. I always feel like when you get that validation from clinicians, it makes you understand like this actually has a use in the real world. And so I think that's very inspirational. So talking more about your co-founders and your advisors and everyone who's been on this journey with you, how did you guys all meet, obviously at the university, and then how did you guys all gel along? What were your initial roles and like how did that evolve over time too? Because I know now you have a more of an executive role too. So
Yes. So when we first started off, I was starting my master's degree. Carla was actually graduating. So she did a lot of the early validation work, comparing our 3D ultrasound technology to MRI. And then when she was graduating, Megan and I were starting our master's thesis. So she actually trained us on a lot of the ultrasound, using our 3D ultrasound technology, etc. She was the one who trained us on how to use all of the equipment. And so she graduated and moved on. At the time, her plans were to get into medical school. So she completed her master's and she was working on applying to medical school. So a year into my master's, when we got to the point where we decided, okay, let's commercialize and let's start up a company, we were like, okay, who's going to do what? So Megan and I were still in graduate school. We were doing our master's, and Carla was working on her medical school application. So we were like, you know what? Given our kind of responsibilities with graduate school, it makes the most sense to have Carla be the CEO because she has the most time, to be pitching, putting together business plans, connecting and networking with people. So when we actually started off, Carla was CEO. Now, a few months after that, she ended up getting into medical school. I ended up graduating my master's. And so it made more sense for the roles to kind of switch. So I
Mhm.
became CEO because now I'm doing this full time. I've been doing it full time for nearly, I guess, 2 years now in the summer. And now she's in medical school and she's working as our clinical strategy lead because she has tons of clinicians and physicians in her network that she's able to connect us with. And so she's really been taking lead in setting up our clinical pilots, securing LOIs from physicians. So those are like letters of intent to either collaborate with Novasonics or potentially purchase our devices in the future. So that's been her primary role. And it works really, really well with the fact that she's in medical school because she's constantly surrounded by physicians. So she's not only training to become an orthopedic surgeon herself, but she's also constantly pitching our device to orthopedic surgeons in her space. So it's worked out really well.
That's awesome. Starting from when Carla started working on this project, start to end, like how long did it take to develop the technology between all of you guys as technical experts?
Yeah. So because our technology, so there's two components to our technology. There's a hardware component and then there's a software component. So the software has actually been in development for nearly 2 decades at this point. Like it's a very well developed and well researched software because it came out of Aaron's research lab. So when we joined our graduate school, the software, the core visualization software was there. We just had to make changes to kind of optimize it for musculoskeletal applications in particular. Now, the hardware went through so many rounds of iteration. So when Carla started, they had one prototype, but then Carla made a bunch of changes to optimize it for hand and wrist imaging. And then Megan and I came in and we, altered some of the hardware to make it fit into our thesis projects. And then through Novasonics, we further made even more changes to make sure that our scanner is not only good for hand and wrist imaging or knee imaging, but it can be used to image any musculoskeletal structure in the body. So, shifting away from that osteoarthritis application, made us have to make some hardware changes to make sure that it works well for any musculoskeletal structure that you want to image. So, We have so many past prototypes sitting in our lab space right now. The people always underestimate how many iterations you have to go through before you get to a prototype that works really well and that you really like. But
Mm. So let's delve into that technical piece of it.
yeah.
How many iterations were there? Like, where did you start versus end up, and like how different did those start and end versions look?
There's probably anywhere between like 15 to 20 that I can just think of off the top of my head since the device was first used on knee imaging and then hand and wrist imaging for thumb osteoarthritis, and then now to being a universal musculoskeletal scanner. And so with every use case, we kind of went through a round of iteration until we found a design that would work for any musculoskeletal structure.
What were some of the biggest technical hurdles that you guys faced?
So I would say for a device like ours, because we're trying to make it a universal musculoskeletal scanner, the biggest hardware hurdle is making sure that your device is ergonomically friendly for any of your target users. So that an orthopedic surgeon, when they use it, it's comfortable and easy for them to use. A sonographer that's scanning however many patients throughout the day can use it the entire day and it's not going to cause them any wrist pain, shoulder pain, elbow pain. You have to make sure that the positioning of the device and how they're holding it isn't going to cause pressure on the sonographer's joints because they already deal with a decent amount of joint pain from their job. So you really want to make sure that you can alleviate some of that. So I would say that that was the biggest part of our hardware design that required a lot of back and forth for us to solve that problem. And we're still going through some rounds of iteration to fix, a few small components of our hardware that we've recently gotten feedback from sonographers. So I would say that that was the biggest part of our hardware is just making sure that it's as comfortable and user friendly as possible. Now, from the software perspective, again, you just have to make sure that your UX UI is intuitive, is easy to use, and makes sense to sonographers, orthopedic surgeons, even radiologists in case that they review the images. Because when you're introducing physicians to a new technology, you want to make sure that you fit into their current workflow as much as possible and you disrupt their workflow the least amount that you possibly can. So we have to make sure that our software replicates current imaging softwares that they used to and that they're accustomed to working with. So that's what I would say in both cases, the hardware and software is the focus has always been usability. We've mastered the back end technical piece where we know we can capture high quality images, but how do we make sure this is as user friendly as it can possibly be?
Hmm. I think that's a really interesting point because Sydney was also talking about user-centered design, and I feel like this is a very good example of very much thinking about who your end user is and what their problems actually are. So that's very cool to see.
Exactly. Yeah.
Um, okay, so then I wanted to ask, you started as Chief Marketing Officer, is that correct? And
Yes.
then you transitioned into the role of CEO. What were some of the commonalities and learnings going from that role to now being CEO?
Yeah, I mean, I was chief marketing officer for about a year, so it wasn't a long time. And when you first start up a company, you and your co-founders are all wearing so many different hats. So, just as an example, pitching our company was a shared role between Carla and I because I really enjoy public speaking and I enjoy pitching. And so it's kind of something that comes to me more naturally, I suppose. And so I didn't mind taking that on. And so when I transitioned into the CEO role, and it was basically my full-time job to consistently be pitching our company, it didn't feel like it didn't feel like a huge learning curve because I was already accustomed to the pitching process. But I will say that as someone with a technical background, switching your mindset from being a completely technical person into looking at how to operate a business and build out your business and build out a slide deck, for example, to make sure that it doesn't have a lot of scientific jargon because most of the audiences that you pitch to don't have a background in ultrasound and don't have a background in medtech or life sciences at all. And so I would say that was more of a learning curve, is transitioning between being a technical person from my master's and my research into being more business oriented.
I think that makes sense, but also having both backgrounds definitely makes you someone who's uniquely positioned to be able to do that translation. So, speaking of translating technical things, if you had to break down in simple scientific concepts how the core technology really works, could you do
Yeah.
that? Yeah.
Absolutely. So our technology is a clip-on. So you'll take your existing ultrasound probe that you have in clinic, you'll clip our attachment onto that. The clip-on itself has a motor in it. So what the motor does is once you start the scan, there's a button on the clip-on that you click on to start the scan. Once you start the scan, the motor will automatically move the probe over the region of interest. So say you position the ultrasound probe over the patient's knee, you don't have to move your hand. The motor in the clip-on will actually move the probe over the region of interest. And so that's where we're reducing a little bit of that operator dependency. Now, in tandem, our associated software that's associated with the hardware is going to capture a series of 2D ultrasound images and stitch them together. So it kind of looks like slices of bread in a loaf. So all of the 2D images get stitched together into a 3D image. And so that's essentially how our core technology works.
Okay. Is this similar to CT where you have like all these cross sections and then
Exactly. That is
okay,
exactly. Yes.
okay. That makes sense. Follow up to that question. Ultrasound is looking in one direction. Is that right?
Correct. Yes.
Okay. So then can you explain how only having one directional view still allows you to get that 3D image?
Yes. So, one unique thing about our software is a lot of times when I tell folks that our software takes a series of 2D ultrasound images and stitches them together into a 3D image, they assume that our software captures one 2D image and then predicts the next few 2D images and then captures another 2D image and then predicts the next few 2D images. But that's not true. Our software actually captures true 2D images. So, all of the 2D images that are in the 3D volume are actual 2D images of the structure that we're pulling out from the ultrasound machine. And what we've done is we've been able to master having the frame rate of our software match the frame rate of the ultrasound machine. And the frame rate is essentially the rate at which the machine captures images that are of a specific resolution. And so that's why, because all of the images in the 3D structure are true high resolution 2D images, you can look at our 3D image from any plane or angle and we're still able to maintain a good resolution.
Okay. How do you align the structures between each frame?
Yes. So a component of our hardware is, I didn't want to get too technical, but we have what are called encoders. So the encoders track the location of the probe in space on an XYZ coordinate system. So each time you capture a 2D image, the encoder records the XYZ coordinate location of the 2D image and is able to stitch all of them exactly based off of the location that they were captured. So the two,
Okay.
the location of all of the 2D images aligns exactly with the location of the probe in any of those positions.
Okay. So it's essentially like defining a coordinate system.
Exactly.
Okay. Very cool. That's good to know. I think a lot of people are like very interested in the technical side as well. So yeah, it's great that you're able to, again, be able to explain both sides. So I want to ask, what's been the biggest, it sounds like you guys have a lot of positive feedback from physicians and end users, but what's been some of the pushback that you guys get? So I feel like every startup deals with some of that.
Yeah, absolutely. Funny enough, the biggest pushback that we get is from radiologists. So we find that radiologists tend to be very used to a very specific workflow. So when it comes to analyzing images, they want to make sure that the image you're giving them looks familiar and it looks similar to any of the other 3D images that they analyze, whether it's 3D ultrasound, MRI, CT. They want to make sure that you're not giving them an image that is structured in a way that doesn't make sense to them, or the user interface of the software is really complicated and convoluted and not intuitive. So that's actually been the biggest point of pushback, where you have to absolutely make sure that your software makes sense to radiologists because they're very strong stakeholders in hospitals. So when a hospital wants to purchase a device or a medical imaging device, they're going to ask radiologists for their opinion. So even though our end user is a sonographer or an orthopedic surgeon, in the case that a radiologist is brought in to analyze the images as a second opinion, we need to make sure that they're on board. So that's
Mm,
been the biggest pushback there. I will say though, anytime we've invited a radiologist to come into our lab and actually test out the scanner, my favorite thing is kind of seeing the switch in their eyes when they use it and they look at the image and they're like, oh, that was actually really easy to use. So that's anytime I get pushback from a radiologist and they're local or they have time to come and visit our lab, I will always offer to run a demo and have them try it out. So,
Mm. So, okay, are you guys still in the same lab at Western University with
yes,
okay,
we are. Yes.
speaking more about that, so I'm assuming like your IP was locked up with the university and you guys had to spin out?
Yeah. So we actually got very lucky in that Western University allows professors and researchers to actually patent their own innovations. So if you have the financial means to patent your innovations, you're free to do so. Like Western will not own any rights to the innovations because they're really trying to drive forward bringing the innovations that are developed in their university to the market. So they're really trying to incentivize researchers to own their own IP. So that's exactly what Aaron did. So before we even spun out Novasonics, Aaron had filed for several patents for different hardware components. And so the IP is currently owned by Aaron. Novasonics is exclusively licensing it from Aaron. And once we hit a specific revenue threshold, the IP will be reassigned to Novasonics. So we have a detailed licensing agreement between Novasonics and Aaron. So we got very lucky on that front because it's much easier to negotiate with your own co-founder than it is with the university. So,
Yeah, what a wonderful policy. I wish more universities would do that. Yeah. Okay, so switching more to your current area of expertise within the company, can you tell us more about the business model for Novasonics right now?
yeah. So currently, I'll kind of talk about our stage and then kind of get into the business model a little bit. But up to this point, we've been running completely on non-dilutive capital. So we have not raised money from investors just yet. And that's something we're really proud of because we've been able to run all of our clinical validation, all of our prototype iterations without losing ownership of the company. But now we're at the stage where we have a prototype that's been clinically validated. It works quite well. It's currently in an in-hospital pilot here in London, Ontario, and we're working on launching a couple of other pilots across Canada and also hoping to enter the US pretty soon as well. And so we're at the stage where we need to move forward with regulatory approvals. And so we're a class 2 device, which means that we're a low risk device because we literally clip onto existing ultrasound probes. And so that significantly reduces the requirements for getting Health Canada and FDA clearance. So we anticipate that by the end of this year, we'll be ready to begin filing for FDA and Health Canada clearance so that we're able to enter market sometime mid 2027. So that's kind of the rough timeline that we currently have. Now, in terms of the business model, because we have a hardware and software offering, what we'll do is we're going to be running a hybrid hardware plus SaaS model. So hospitals and clinics will be able to either outright purchase or lease our technology along with the core visualization software, but we're also working on developing a suite of AI tools that will automatically quantify different disease markers. And so those AI tools will be offered on a subscription basis. So that's the business model that we'll be operating under.
You said some hospitals will have, or some of your users would have an option to lease. I'm wondering, like, what is the cost of goods here and what are profit margins looking like? Why is leasing an option?
Yeah, so we found that smaller clinics would be more interested in leasing because they kind of want to avoid that upfront cost. That being said, our pricing, we have different forms of our scanner, and I will get kind of into the technical details of the differences, but we have one scanner that we've priced so that it's affordable for smaller clinics and clinics in remote communities. And then we have a larger, more comprehensive system that's better suited for hospitals that is priced a little bit higher. But in both cases, we've made sure that our pricing aligns with existing ultrasound hardware in market so that clinics and hospitals aren't paying a lot more for a device that's meant to provide accessible imaging for folks.
I like that kind of like tiered approach and really making sure that you're ultimately helping the patients that you want to be helping. So,
Exactly. Yeah.
yeah, you kind of hinted at this earlier, but what was the transition like from being all these technical people in a lab together working on this amazing technology to then like being co-founders and having to hammer out founding agreement and split shares and all those things? Like, how did that go? And what were the things that helped in that process?
Yeah, I mean, the main thing that I'd always recommend is find the lawyer to help you put all of those agreements and documents together. I think sometimes people try to avoid the costs of legal counsel, but it's definitely important to make sure that the rights of all co-founders are protected. So that's something that definitely helped us because it was starting up a company and having co-founders and putting up a shareholders agreement was definitely something that was out of our wheelhouse. Like, we're all technical co-founders. That's not something that we're familiar with. So that was definitely something that helped us define roles and responsibilities, define the share split. I think at the early stage when you're bootstrapped and there is not any money involved, like, people are just really passionate about the solution, negotiating terms and the share split is a lot easier. And so that's another thing that I would also recommend with startup founders is make sure you have those negotiations before you begin raising capital or bringing in investor money, because that's when you have a valuation for your company and it becomes much harder to negotiate how the shares should be fairly split. So the earlier you do it, the better, and have legal counsel to help you through that process.
Mm, okay. I also wanted to ask, so you talked about getting ready for FDA approval, and so I assume there's a lot that has to go into scaling up manufacturing, building these relationships, which is probably a lot of what you do. So I guess, can you talk more about the plans for that?
Yeah, so we currently manufacture our device in-house. So all of our prototypes are built in-house with contract engineers that we work with, but that's obviously as expensive as it can get. You do not want to be manufacturing in-house once you're actually beginning to scale up and sell. And so what we've done is over the past year, we've spoken to a whole bunch of different medical device manufacturers across Canada and really narrowed down what our needs are and what we would like to get from working with a medical device manufacturer. So really, what are the areas that they can help us with aside from scaling up manufacturing? And so we've been able to define a manufacturer that we'd like to work with through both the process of finalizing our design for regulatory approvals, but to also work with as we begin manufacturing devices, our first few devices for our early customers. And so, the process of finding the right manufacturer requires a lot of networking, attending events where all of these manufacturers go to and talk about their companies, but also speaking to other founders. Something that I found really helpful is going into these manufacturers' portfolios and finding different founders from each of these companies and asking them about their experience. Because every manufacturer is going to speak very highly of themselves, but you really only know how the experience is working with them when you talk to someone who's worked with them. So that was something that was really helpful and that I would also recommend in the future to any founder who might be listening who's considering working with a contract manufacturer is find other founders that worked with that manufacturer and see what their experience was like before you sign a contract with them.
Hmm. Okay, that makes sense. What do you guys project adoption of this tool will look like as you guys get this FDA approval and Health Canada? Sorry, I'm not
Yeah.
from Canada, so I feel like I'm
Oh,
not as inclusive sometimes. But
no worries.
yeah, what do you expect kind of that adoption ramp to look like?
We anticipate that. So, in terms of clinical adoption, we anticipate that clinics will actually be our first few adopters in comparison to hospitals, merely because hospitals have very long sales cycles. I don't know if you're familiar with how long it takes for a medical device company to make a sale to a hospital, but it takes on average anywhere between 6 to 12 months. Whereas the sales cycle for clinics is much shorter. It's half of that. It's anywhere between 3 to 6 months. So we anticipate that our early adopters are likely going to be outpatient medical imaging clinics, outpatient orthopedic clinics, and outpatient sports medicine clinics, because we're just going to be able to capture those sales a lot quicker. In tandem, as we're selling to clinics, we're still going to be working on the sales process with hospitals, but we really want to ensure that we can generate revenue as soon as we can. And so focusing on clinics initially makes a lot more sense for us than focusing on hospitals.
I want to ask, going back to like where it all started. Every founder has these green flags and these red flags, like no way, I'm not doing this, or yes, this is a great idea.
Yeah.
What are those for you, and how do you advise people who come to you with different ideas?
So I would say the first red flags would be, did you validate your product market fit? Like, is there actually a user for your device? and this is something that we're very familiar with in the research space, because a lot of times in research, we develop these new technologies and these new methods for different clinical applications, but we don't consider whether this is actually needed in clinic or wanted in clinic. A lot of research is done because it's interesting and it's cool, and researchers love to do research, but a lot of research cannot be well translated into clinic because there's workflow issues or physicians don't actually want the solution. That's not the pain point that they're after. And so that's one red flag for me is, did you define your product market fit? And that was actually a red flag that was raised to us when we first started Novasonics and we were focused on osteoarthritis. We would constantly get pushback on what are the physicians saying. And that's when we actually had to do a lot more customer discovery and really understand where our product fits into the market. And so to help other founders kind of not go through that, having to pitch their idea and then having to do their customer discovery, I just tell them from the outset, like, make sure you're talking to physicians and clinicians and really making sure that this is something that they want. So that's the primary, I guess, red flag is there a need for this in the market? Now, in terms of green flags, I guess, green flags for startup ideas would be someone who's defined, their product, their market, validated their product market fit, has already talked to physicians and clinicians and did that customer discovery process. And also did their market research. So a lot of times people have ideas for startups or technologies, and you could just do a quick Google search and find that there's other 5 to 10 other companies that have done the same exact thing. And you really need to, and it doesn't mean that you can't be a competitor in the space, but you really need to define what's your differentiator amongst these competitors. Because that's also a question that you're constantly going to be asked as you're pitching your technology. And it's a question that you're constantly going to be asked as you're pitching to investors is, what makes you different than other people in the market? So founders that have that really well defined and have their market research done and super detailed, again, another green flag that they're headed in the right direction. So those are just a couple that
Mm,
come top of mind.
yeah. No, that's really interesting because I feel like a lot of, especially people coming from a technical background, are like, what matters the most is that I have the best product and that it works perfectly. But
Exactly.
literally everything you just mentioned was actually not that. So, yeah. Oh, that's really cool. It's been awesome hearing about your journey with Novasonics. Where do you see Novasonics going in the next 5 to 10 years? What impact do you hope it will have on patients?
Yeah, absolutely. I mean, in the next 5 to 10 years, we hope to have expanded beyond Canada and the US. We know that our device can be expanded into clinical applications beyond musculoskeletal use cases. So in the back end, we've already explored applications in breast cancer screening and biopsy, thyroid cancer screening, stroke risk assessment, amongst others. And we know that there's, a global need and market pain points that we can solve in each of these clinical applications with our technology. And so in 5 to 10 years, we hope to be expanding our technology to be more of a platform technology that can be used across different clinical indications.
Mm, can't wait to see that happen. What personally drives you to do the work that you're doing every day?
I think this goes back to kind of where Novasonic started, is the one thing that drives me forward is, and the one thing that drove me to consider commercializing the device is, we have a technology that's been clinically validated. It works really well, and you get, high resolution, high quality 3D images. And we know that it can have an impact on clinical care. And so it seemed short sighted for us to just keep it in the lab and use it as a research tool. And then in 5 to 10 years' time, it sits on a lab bench and collects dust. And so that's really what keeps me going is, we understand the impact that our technology can have on patient care. And so even on the hard days, that's something that you have to tell yourself, that we've been able to develop a technology that in a unique way produces accessible 3D imaging. And so that's definitely something of immense value. And so we have to get it into the hand of physicians. There's
I
no ifs or buts.
I love that. Thank you so much for sharing your journey, Randa. I really appreciate it.
Of course, and thank you so much for having me.